On to our next speaker. He is currently the Deputy Executive Director of the National Institute of Health of the University of the Philippines and the scientist behind the first local COVID-19 testing kit. He was included in the Asian Scientist 100 list of the Asian Scientist magazine and is known for leading the development of the SARS-CoV-2 PCR detection kit. He was also cited for his creation of the award-winning Biotech M-Dengue Aqua Kit for a faster, more affordable, and accessible dengue diagnosis. Here now to talk about driving innovation to prepare for the next big one, let's hear it from Dr. Raul Destura.
Good afternoon, everybody. My name is Dr. Raul Destura. Thank you very much for the invitation to speak today, and congratulations to the organizing committee for a very successful event. So today I will be talking about the topic requested from me, driving innovation to prepare for the next big one. But this will be coming from an area wherein some of the resources are a little bit of a challenge in preparing for the next big one. And so let me have my slides. So the coronavirus is one of the most difficult collective challenges facing humanity since the last World War. And amidst this turmoil, all agencies related to health delivery and care are really doing their best to be able to save lives and find therapeutic cure and race for the best vaccines that we can actually put together. And which tells us that despite of all the things that we have in the world, no, a pandemic such as this scale really rattled the entire global community. Next slide. So crucial to outbreak or epidemic preparedness is the ability to identify the offending agent as well as having the capacity for scaling up diagnostic technology that will allow rapid detection to facilitate mitigation and control measures. It's easier said than done because at the time is when you develop, when you are faced with a new virus that is unknown in the global community, you need to identify first what the virus is before you can actually develop technologies that can be scaled up. So preparedness includes access to technologies that will allow you to rapidly identify such unknown offending agents. Next slide. May I have the next slide, please? So, but the problem here is it's not just about ourselves because the technology, the raw materials are virtually coming from outside because the local capability in most developing countries, for example, the Philippines, is the dearth of raw materials to start putting together your capability programming. So the cost-limiting nature of the molecular tools for diagnosing infectious disease in the Philippines led to the creation of the molecular diagnostic program at the National Institute of Molecular Biology and Biotechnology way back in 2007 when I was still the director at that time. Next slide. So based on that, we have created panels for neglected tropical diseases, for TB, multi-drug resistant organism, waterborne parasites, influenza, and HIV drug resistance profiling, starting developing platforms that will be able to provide access later when the need arises. Next slide. So this program was actually adopted as the flagship program for communicable diseases of the Philippine Genome Center here in the Philippines. Next slide. And the technology that actually came out is the Lab in the Mug project because at that time the country has limited technology for using molecular tools because of the cost of PCR machines were very expensive at that time. So we created an isothermal unit that amplifies DNA and RNAs in a single temperature. Hence, we were able to develop the Biotech M dengue kit which is the first technology coming out from this project. Next slide. Because of the Tech Transfer Act of 2009, we were able to bring out this platform into a commercialized version that allows us to work on the product all the way to the other end. Next slide. And through the approval of the Board of Regents, next slide, the birth of the first spin-off company is the Manila Health Tech Incorporated was actually created in response to this need. No, next slide. So this particular product actually was recognized in the ASEAN Novel Diagnostic Innovation Panel to be crossly distributed to the entire ASEAN region and was a gold medalist in the 46th International Invention Exhibition in Geneva for dengue diagnostics. And based on that, we developed all other platforms using this technology for other neglected tropical diseases that are not financially viable on a global scale, but it's really needed in developing country conditions like the Philippines. Next slide. So the company has shifted to robotic-based technology and is the only licensed molecular manufacturer for the molecular diagnostic technology in the Philippines. Next slide. And then COVID-19 came. So the presentations, our preparations for infectious disease at that time was based on the dengue epidemic that happened in 2019 and 2018. Hence, the technology for dengue was actually utilized and distributed in several regions of the country. And then while we're working on that, COVID-19 came, and again, the challenge in rapidly responding to develop the technologies for that. The good thing about it was way back in January, the genetic sequence of the virus was actually released in the National Library, and we were able to review the complete genome and based our designs on the sequences that has been uploaded in the data bank. Next slide. So based on that, RT-PCR technologies were based on several target genes, the RNA-dependent RNA polymerase gene of the ORF1ab sequence, the E gene, the N gene, the S gene. And among this, based on initial studies, the RDRP targets had the highest analytical sensitivity, so we focused on these areas. Next slide. So we designed the locally developed technology based on these three gene targets, the E gene, the RDRP, and the human internal control, the human RNSP gene targets. Hence the birth of the Gene Amplify COVID-19 RT-PCR detection kit here in the Philippines. Next slide. So this is an example how an industry and academic partnerships accelerates development of products and services in the national and international emergencies. The Department of Science and Technology, which is the funding agency, in collaboration with our team from the National Institutes of Health and the Philippine Genome Center, an industrial partner like Manila Health Tech Incorporated, generated the platforms in less than 30 days and later on had the ability to scale up at 8,000 and currently at 12,000 tests per day using our robotic-based manufacturing facility. Next slide. So this has been distributed in most centers in Luzon, Visayas, and Mindanao, and is still currently supporting new laboratories that are opening at the moment. Next slide. But before COVID-19, we already know that the entire world was not ready for a pandemic of this scale. Next slide. In 2019, the Global Health Security Index, which is the first comprehensive assessment and benchmarking of health security and related capabilities across 195 countries that makes up the state parties to the international health regulations, developed this for programming. Next slide. So it's a project of the Nuclear Threat Initiative and the Johns Hopkins Center for Health Security and was developed with the Economist Intelligence Unit to address one of the world's most omnipresent risks, infectious disease outbreaks that can lead to international epidemics and pandemic. Ironically, this was a 2019 Global Health Security Index, and also the end of the year is the beginning of the pandemic. Next slide. So basically, the health security index questions are organized across 6 categories: prevention, detection and reporting, rapid response, health system, compliance with international norms, and risks environment. Next slide. And basically, out of this report, it revealed that out of the prevention strategy, fewer than 7% of countries score in the highest tier for the ability to prevent emergence or release of pathogens. Next slide. In terms of detection and reporting, only 19% of countries receive top marks for detection and reporting as well. Next slide. For rapid response, fewer than 5% of countries scored in the highest tier for their ability to rapidly respond to and mitigate the spread of an epidemic. Next slide. And in terms of health system, the average score for health system indicators is 26.4 of 100, making it the lowest scoring category on a global rank. In terms of compliance with international norms, less than half of the countries have submitted confidence building measures under the Biological Weapons Convention in the past 3 years as an indication of their ability to adhere to important international norms and commitments related to biological threats. Next slide. For risk environment, only 23% of countries score in the top tier for indicators related to their political system and government effectiveness. Next slide. So where do the Philippines stand in the Global Health Security Index scoring? We rank at 47.6 in terms of out of 100, or 53rd out of 195. And we are barely crossing the 50% mark now in all of these 6 categories. Next slide. We failed in some areas like biosafety and the dual use research. Basically, we are doing well only in immunization and antimicrobial resistance programming. Next slide. But take note on the last column, this is the global score, and the second to that is the country score. We're doing a little bit in some of these areas, but obviously when you look at the granularity of this scoring, we still need help in some of the areas that we are putting in. Next slide. In terms of rapid response, we scored at 43.8 as opposed to the Global Health Security Index score of 38.4. But we have problem linking with healthcare and security authorities. Next slide. In terms of health system, we are at 38.2 with the average score in the global at 26.4. So take note that this is out of 100. So even if it's higher than the global score, it's really low. Next slide. And in terms of compliance, we are at 49.8. And then the global index is at 48.5. Next slide. For risk environment in terms of political, security risks, socioeconomic, infrastructure, environmental, and public health vulnerabilities, we are at 50.3, and the global rank is 55.0. Next slide. So the overall findings provided this heat map in terms of preparedness for pandemics and epidemics. The one in yellow are considered to be the most prepared. The one in orange are more prepared. And the one in red is the least prepared. Next slide. But look at this data. The one on top is the health heat map of COVID-19 cases globally. The darker the color, the more intense is the transmission. Look at the issue related with the one below in terms of preparedness. It's a little bit odd that the most prepared had the darker colors and the least prepared have the lighter colors in terms of COVID-19, which gives me make us be questions. Maybe there are other reasons that will also affect our ability to respond to the epidemic, or maybe programs are in place and it's just a matter of how it's going to be executed by the leaderships. No? Next slide. So the overall finding from this report, the Global Health Security Index, is that national health security is fundamentally weak around the world, and no country is fully prepared for epidemics or pandemics, and every country has important gaps to address. And the average overall Global Health Security Index score among all 195 countries assessed is 40.2 of a possible score of 100. Next slide. So, what's my personal take in terms of preparing for the big one? Biopreparedness for emerging infectious disease emergencies is not mainly, though important, on creating the infrastructure, and that understanding country-specific or culture-specific social norms requires integration into the preparedness program, which is easier said than done, no? Very difficult to execute. And I feel that the strength in the governance and leadership structure may be an extremely crucial component, not maybe, but it is an extremely crucial component, no? Can you go back to the slide? It's a crucial component for a successful preparedness program because no matter how well established a preparedness program in a certain country, it will not run on autopilot. So transdisciplinary multi-agency government-private sector collaborations are needed to address a multifaceted infectious disease emergency like a global pandemic, and that creating silos is a recipe for a bigger disaster. Next slide. Next slide. Hmm. So the global infectious disease emergencies demand attention and cooperation of the local community, and our common humanity requires that our resources be directed at preserving and enhancing life wherever it is endangered. As members of the community of science, the humanities, engineering, and technology, we must strive to actively participate in the national and global to alleviate the impact of emerging and re-emerging infectious disease emergencies by building on existing local research strengths and growing international collaboration, providing excellence and innovation in the field of research, training health professionals, and creating and sharing health knowledge. Next slide. Thank you very much for your attention.
Thank you, Dr. Raul. So we have Asian Scientist Top 100, but really a noble and grounded director of the Clinical Research and Translational Institute in the Medical City. So thank you for that insightful speech, Dr. Raul. We are now opening the floor for a short Q&A. Please submit your questions to Slido using the code 45616.
Okay, I think we have our first question from one of our participants. With natural calamities depleting our resources, how can we pursue innovation in driving change?
Well, the most important thing in developing in putting innovations to control effects of how we deal with our environmental perturbation is that when we develop technology, we tend to forget the environmental consequences of the technology we're trying to put together. Human encroachment is something that affects our innovative spirit. We tend to look for solutions to areas that we should be going. In the process, we are destroying some of those environment and hence facilitating the movement of infectious disease from a controlled area over the other. Um, but if you want to develop innovation, you develop technology. It's not only address a particular question, but doesn't add problems to the existing ones. And again, it's easier said than done. Sometimes when I mentor my younger scientists, before I let them sit in the bench, I throw them into the field so that they will know what the real needs are before they start dreaming of a solutions within the corner of their laboratory space. So they need to be grounded and have a good interpretation of what the problems are. So innovation is finding better ways of doing things, right? And when you say better ways, it means it improves existing, but doesn't downgrade the good ones that we have already created.
Investment on research and development.
Sorry, I can't hear the question. Is there a question?
Okay. Once more, Dr. Raul, our second question is, how do we change the mindset of some leaders in developing countries like the Philippines to put premium and investment on research and development?
That's a very good question. The only answer to that is look at what is happening now. It is science and technology and innovation that is helping uh, control the pandemic. Artificial intelligence, advanced monitoring system, molecular tools for rapidly diagnosing the disease, sequencing technology that allows us to identify diseases rapidly. These are actually research and development investments. The problem there is, um, though it is available, access is an issue. Um, Continuous funding and support for its growth and development is also limiting. But in fairness to the Philippine side, the Department of Science and Technology has been at the forefront in providing support for new technologies for the pandemic response. Do they have enough resources for that? I wish they have more, but I think they have maximized the resources that they have at the moment. And they are always dependent on the political leaders on how much more budget they will allocate for research and development. And hopefully, what happens is enough learning experience to invest on research and development for science and technology and innovations in the country. Because I think it's what will move the economy forward. And we have a lot of young, bright, driven, inspired, patriotic scientists in the Philippines, just waiting for an opportunity to be of service to the country.
Okay, we have a third question from via Slido. How do we ensure continuous delivery of PPE to address the demand of our frontliners without compromising their safety?
Well, it's $100 million question. The problem with the PPE is actually the availability of supply. No? But I had been in discussion with the Philippine textile industry, and they are now putting up the internationally international standards for assessing personal protective equipment for masks from N95 to N88. And that local capability of being able to measure and verify whether this particular is actually protecting, then that can be a good local source of PPEs. No? It's a really big challenge. No? It has something to do, again, with biological preparedness programs, meaning you don't respond to an epidemic when it happens. You respond to an epidemic 10 years before it actually happens. And part of that is stockpiling of personal protective equipment because it's not just a problem here in the Philippines in terms of supply for PPE. It became a problem on the global scale before. But those countries that actually are very serious in biological preparedness had lesser problems than those who did not prepare significantly. So it's a global problem, and we had our own share of that problem here in the Philippines.
All right, Dr. Destura. So, talking about global changes or occurrences, the question for you, I think this is the last one. How strong is the link between climate change and the emergence of infectious diseases? Will addressing the climate change have a beneficial effect on healthcare? And how about addressing country leadership issues?
Okay, climate change is real, and for those who do not believe in it, just wake up and look around you, and things are happening. Climate is a smart, is important promoter of emerging infectious disease. Why? Changes in the pattern of the environment, like for example, previously cold areas are now warmer. So mosquitoes or insects or vectors that normally will not survive in that area can now thrive. And some of these vectors can harbor viruses, and all of a sudden, you get outbreaks of dengue, chikungunya, Zika, West Nile viruses. In previously uh, free infections from this, but since of the warmer climates, and we are seeing more emerging infectious disease in those areas, and that is just one example. And if the habitat is no longer applicable for thriving such ecosystem in that area, there's a tendency for animal migration to one place to the other, carrying with them um, centuries of viruses that hasn't been exposed to humans. So these are just small examples of what the climate problems affecting human health. And that is just for infectious disease, no? There are also impacts related to non-communicable diseases like heat strokes, uh, hypertension, and all of these things that's going on. We can run the list one after the other. The problem is we are in a globalized community, and whatever health impacts is going on in another country impacts another, and vice versa. So uh, it has something to do with how we treat the place we live in, right? In terms of leadership, it's very difficult to answer that question because it is something to do with the one leading. If the person who runs a certain program or a certain country or a certain will study and do his homework and honest enough to believe that sometimes you don't have the answer to everything that you need, no? And reach out to those who actually know what they're talking about in certain areas. It's a hallmark of a leadership that understands how to maximize his weaknesses, his strength, and meet his weaknesses in terms of a leader. I'd like to see that kind of person someday, and it is something that we can emulate for all, and hopefully we see them uh, while we're all still alive. Yeah, thank you.
And that concludes our Q&A, ladies and gentlemen. Thank you so much, Dr. Destura.
Now, this event would not be possible without our bronze sponsors, Minitab, San Miguel Yamamura Packaging Corporation, ACF Consultancy and Training Services, Alson's Power Group, and Beyond Reality. Thank you all so much for your support.
Friends, we hope this has been truly an exciting, fulfilling, and engaging learning experience for each one of you.
Now, at this point, we would like to announce the winners of the Asus laptop bags. Our first winner is Juvillian R. Casabuena of Nissin URC. Next, Jocelyn Tizon of Southville International School and Colleges. Joshua Palisok, Ask Lex PH Academy. Maria Janelle San Miguel, Continental GBS Manila Incorporated. And Maria Teresita R. Yage of the South Mansfield College.
So thank you everyone for joining us.
We hope we were able to bring you another unforgettable learning adventure to inspire us to stay positive and brim with optimism. Now, we look forward to more collaboration as one global community in order to transcend the challenges of the pandemic in the age of digital transformation. Now, as we bring our 2020 learning adventure to a close, let us be reminded of the insights from astronaut Neil Armstrong on April 20, 1969, when he was ready to plant the first human foot on the moon. And as he climbed down the ladder, he uttered these famous words: "That's one small step for man and one giant leap for mankind."
Folks, we've just taken that small step. I think it's time that we take that giant leap.
And we hope to see you all again in 2021. Hashtag stay positive, hashtag be inspired. Once again, I'm your co-host, Jeremy Domingo.
And I am Jamie Sanchez from the Medical City. So this has been the first World Innovation and Benchmarking Summit.